Medicare task force meetings, and I've already corresponded a little bit with John about this report. And I will say this too, that the request is simply for, as we are always doing, trying to be diligent about the information that we're dealing with, to try to keep abreast of what's going on in other states, and to reiterate, definitely from the leadership of the committee, both Representative Hammer and myself, and on behalf of the task force, there's no preconceived notions. We're looking for data so that we can be able to articulate where we stand amongst our peers in the nation and also with our own situation here. So with that, Mr. Stephen, if you would state your name for the record, who you represent, and also you have another staff person with you.
John Stephen, the managing partner of the Stephen Group.
I'm Lindsay Littlefield, the senior consultant with the Stephen Group.
Thank you. You're recognized.
Thank you, Senator. I'll be real brief because I'm going to hand off to Lindsay to handle the analysis that she did. But I wanted a couple of questions that came up that I want to offer some assistance with. On the match, the federal government match, just so you know for the future, if it's a medical service, the match is a 75-25%. 75 federal, 25% state in every single state in the country. If it's an administrative cost, purely administration, it's a 50-50 match, state staff positions. And then every single state has its different match based upon its per capita income. You're one of the lower matched states in the country, and your match is a 69.9% federal, and then the remainder being the state of Arkansas.
Is that for just the admin? Or
No, your normal Medicaid match is about, is really, think of it as a 70-30.
Okay, all right.
So when you start really looking at a budget and you're identifying financial status situation, it's almost a blended. You have to really look at what are you talking about. Are you talking about administration? Are you talking about medical? Or are you talking about your general Medicaid program? Your services, your community services, non-medical. So that's just for the committee. And then also, and I know that the committee members know our role here is to assist you, as Representative Hammer and Senator Rager have told us. The issue for us is to get you the data and the information that you need to make your decision. One of the things that I want to make sure I highlight, our charge was to present to you ideas on efficiency savings, the original savings estimates that we used for the committee that you adopted in your task force report did not include the HDC savings. So I want to make sure that it's clear to everyone here as well. The $800 million number that the governor had issued early on did not include HDC savings. When we had talked about the savings in the program at a 5% savings rate in the DE area, developmentally disabled area, we looked at the programs that are mainly in the community-based care programs. So there was still no HDC savings on the figure that we had. The 5% figure was about roughly $28 million a year in the developmental disability area. So that was off a 5% growth factor. So you're still, the program's still growing under our analysis at 5%. And we thought, and the task force agreed, that you'd be able to make that the savings up. In this committee's focus, the way we understood it, and we're continuing on that unless it's different, senators, that we want to look at data around the country and make factual and data-based recommendations to the task force, and we're going to help you with that. And so at the end of this process, and even during the testimony, if there are issues, we're going to be taking notes. Richard Kellogg from my team is also here, who's a behavioral health and developmental disability expert, a commissioner of both in many states. We're going to be taking notes. If there are questions that we can help you with, we will, and we'll continue to do some data analysis as we go forward.
Thank you, sir.
And so with that in mind, I'm going to hand it off to Lindsay, because one of the questions that came up at the very first meeting was when Melissa had presented on behalf of DHS the cost per facility in Arkansas. The questions from the members was, how does Arkansas compare to the other states in the country? So we were able to get that analysis for you, and Lindsay's going to testify to that analysis and answer any questions.
Thank you. The department has already discussed the criteria for admission, so I won't spend too much time on that. Just to note that our research focused on large state-run facilities known nationwide as intermediate care facilities. And these are facilities with at least 16 or more persons, but the majority that we looked at are comparable in size to your state. If you turn to slide 3, I believe this is information that was previously shared by the department, but provides a snapshot for you by facility of the census, the annual budget, and then breaks that annual budget down into a per person annual spending and a per diem spending. So to put Arkansas spending and population in context, we consulted 2 large national studies that have been collecting information from states for a number of years. The latest reports were published in 2016 out of the University of Colorado and the University of Minnesota, so that's serving as our source material. Those reports include data through the year 2013, and in some cases we did some additional work to update information. So on slide 4, just to provide some context, and this will play into some of our analysis at the end of the discussion today, we just show states in terms of the number of state facilities that they operate. In 2013, there were about 160 nationwide. That number today is a little bit closer to 150. But this gives you a breakdown of states with their similar peer groupings. If you turn to slide 5, this is just some updated information, just to note that since the 2013 data was collected, there have been some.
Interrupt you just
Sure.
to make sure, since we have audio recording that's going on, and I don't know that the slides will necessarily accompany that. I noticed that Arkansas does fall within really the majority category, correct?
Yes,
With 20, I think there's 29 states that have 1 to 5 facilities in operation.
that's correct.
Okay, and really the balance, you really only have 14 states out of the entire 50 that have 0 facilities whatsoever. Is that
Correct.
correct?
Correct.
I think that's important. I think sometimes the idea is when we hear from some of these folks is that Arkansas is about the only state left that has any facilities open. That's definitely not the case. So I appreciate you letting me get that on the record real clearly.
And since that 2013 data was collected, there have